With the intensity of becoming a doctor, what is an effective way of dealing with anxiety and stress? That is an incredibly good question. It's also very difficult for us to answer in a simple webinar because dealing with stress and dealing with anxiety is, number one, very personal. You have to have had some experience with using different types of techniques and seeing what works for you and experiencing with different things. And also there's a lot to learn about that and unpackage and know about yourself. And it's a complicated sort of topic. But just for the sake of it, let's just do some, say like top two tips for someone who is, let's say, 17, 18 years old, for example. Mm-hmm. What can someone in that situation be doing right now to effectively, impactfully increase their stress and anxiety management?
So I've just got one thing, and that is what a lot of psychologists and psychiatrists say is do the basics and do the basics well. So it's about keeping those good habits. So if you are into a routine, then if you do daily mindfulness, if you are able to get a good sleep hygiene. Sleep is super important, so getting to bed at the same time every night, making sure you get your 8 hours. I know that you feel like you don't need it, but actually try it and see how you feel afterwards. Making sure you limit like alcohol and smoking and all those extra things that we know that we shouldn't be doing, but when you're anxious you're like, I just need a drink. Well, actually try and take some of those basic things and keep a good habit of it. And I think that's my
definitely
do the basics well.
Basics, I just can't emphasize it enough, honestly. For me, one of the basics that I had neglected was sunlight, actually. I realized that because my office is in a basement, by the way. So there very little sunlight penetrates through concrete. So for me, I realized that the basics were like good diet, have regular exercise, have supportive friends, actually sleep, get sunlight, and that did a lot for my mental health. Sanjeev?
100% agree. Get to the basics, man. Sleep, so important. Good quality sleep as well, not sort of anxious sleep, waiting for the phone to ring or waiting for something to happen. And then you're eating well, having some exercise. You don't have to be a sporty person. It could just be something that just sort of gets your heart racing, gets your mind a bit clear. And probably the other thing which I would have probably I think lots of people benefit from is just learning how to prioritize things in your life. Because a lot of the stress and anxiety is because you've got either too much to do and not enough time to do it, or too much to do at that particular time. And learning skills in terms of prioritizing will help you realize what's important, what I need to focus on, and then just sort of wash away the rest for now and then come back to it later, instead of having all those different things running around in your head and you just can't get anything done.
I'll have to steal the final one. My 2 points. One of them is definitely prioritization again, but not just prioritizing, but know when it feels overwhelming, just get into the habit. And it will be very difficult at first, especially if you are normally quite a high-strung person, but get into the habit of saying, okay, look, what is going on right now? What are the things going on? And then think, okay, what can I control and what is outside my influence of control? And think some of the things that are outside my influence of control, can I influence them? Maybe I can do more than I think. And the things that I do have control over, what can I do about it? And turning all those emotions into actually a plan and saying, okay, this is what I'm going to try to do. And even if the plan sort of fails, just the act of sort of settling down and putting it down and slowing things and making explicit can go a long way to just helping you process. This is why I think a lot of people, writing in a diary or journal writing, just slowing thoughts down and just expressing it can be useful. My second one personally, is meditation. I meditate a lot, and I've meditated for a very long time. I started meditating when I was 10 years old. So obviously that wasn't in my control. But I was fortunate enough that I was brought up Buddhist. So I ended up meditating when I was real young, and then that just continued through. Straight up meditation has just changed my entire life. And you sort of need to think about it. It's not, meditation is not usually like a pill that when you take it and when you do it, it just solves the problem. Meditation is like going to the gym. You do enough reps and your mind in a way gets stronger, if I simplify it. so that it's more able to deal with some of the things. It's more able to put aside a few thoughts. It's more able to quiet things down, or, controls that and regulate a little bit better. Anyway, super complicated stuff, but just a few things for you to think about. Next question here. Next statement was, Liz, you're amazing. Second career with a child. I identify with you. So I would say, yep, accurate.
Just kudos to my family. Yeah. That's a lot of pressure that goes on their family to make that happen.
Yeah, I'm sure. Yeah. What are the days off like? Do you ever get breaks? Sanjeev, do you want to start with that?
Yeah, definitely get breaks. The days off are good. Sometimes, like I said, you have busy weeks, so sometimes your days off are just wanting to relax and not think about work, not do things. But the breaks are awesome. You've worked hard, you've earned some money because you've been working this whole time, so you get to spend some money, you get to go on holidays, you get to buy things that you want to buy if you want to. You get to hang out with your family, hang out with your friends, hang out with your colleagues. The time off, I think the fact that you work so hard, you really value your time off. And when you have your downtime, you really want to make the most of it. And I think most docs, and not just doctors, but people who are working in pretty high-strung areas and high time commitment jobs will say the same thing. Like, time off is highly valued.
Yeah, rare commodity. What would you say? Anything different?
Oh no, I'm just laughing to myself because in all my spare time that I had off from the hospital, I was running this social enterprise.
Yeah, same actually. Yeah, I worked on my time off.
So every RDO, which is a rostered day off, which has only just come in recently to help with the junior doctor hours, I was actually spending researching and developing this social enterprise. So it actually got me through my first year.
Yeah, I agree.
Yeah, passion to be like, yes, Thursday, Friday, I'm off this week. I get to focus, have meetings during the day. So that really kept me going. But also at the same time, the other aspect of it is that in medicine, because I was doing research, I was able to go and present that at international conferences. And you get sponsored to go, well, not sponsored by drug companies or anything, but you can get grants to go. So, for instance, I got to go to Houston and speak to the Digital Health Conference there.
Oh, that's right. I remember that.
Yeah. So I took my family with me, went to Hawaii for a holiday first. And because of the way the RDOs ran, I only had to take 2 days of annual leave. And I got like 2 weeks holiday. So, there is some perks to working hard and doing all the extra stuff as well.
Yeah. Yeah, I think a question that I got asked a lot, because I started my social enterprise when I was in my 5th year of medical school, and then I did honors, and then my final year of medical school. And even before that, I was doing a lot of work. So I typically would work, 60 to 100 hours. And most people would say like, oh, how are you managing to juggle all of it? But in my view, it was like, it's because of this other stuff that I can do this other, it allows my brain to have another way of thinking. So yeah, you definitely do get time off. You really get a lot. We have talked a lot about the long hours and things, but you do get a lot of time to yourself. If you can manage your time, you really are able to have a lot of time for family or friends or hobbies and things. And a lot of doctors will, continue hobbies. Yeah, it does take some effort and time management to do it, but it's not impossible. Just actually to give, this might be a useful sort of thing to give you a sort of guide. In terms of what does it feel like depending on number of hours that you work. So 40 hours a week is a normal job. When you work 40 hours a week, you have pretty much half the day every day to do things. So you end up having quite a lot of time. When you work around 60 hours a week, that's when you start feeling like I'm working quite a lot. Like I'm really working decent number of hours. You're really starting to have to prioritize and manage your time quite carefully. When you start working 80 hours a week, you don't really have so much flexibility for anything else anymore. You're really just trying to prioritize sleep. And then beyond 80 hours a week, so around 100 hours a week, you are really, that's not sustainable. That's when you're cutting down on sleep. That's when you have very little else going on in your life. You just wake up, work, or do whatever, and then you sort of go to sleep. So for me, 60 to 80 hours between that period of time still feels like I've got enough in my life to do other sorts of things. 40 to 60 hours, it's like there's leeway sort of there. And if I have to go above 80 hours, then that sucks big time.
But Sanjeev, you developed chatbots in your spare time.
Yeah, I forgot about that part. Yeah. I guess unlike you guys, I was a bit late to the sort of social enterprise game. So during my first couple of years of house surgeon time, I didn't do anything that productive outside of thing, but I just hung out with people and traveled. But yeah, the last couple of years, I definitely agree. Like having that stuff as well definitely was a driver for me. Like, you know, I'd be looking forward to like my evening so I could do some work on it, or, you know, I'd stay up late to do that. Like I'd rather stay up doing that than, you know, stay up studying. And then the same thing in the weekends, like I'll be working on it like out of my own time, knowing that I'm not making any money doing it as well. I guess that's my Indian brain coming out. But like I was motivated to actually do it on my time off. So I think having passions for stuff like that is really important. And if you've got something that you're passionate about that you want to do, that you should really pursue it, especially if it's sort of potentially lining along some of the stuff you're doing. So like I think all three of our sort of passion projects are sort of medical in some way. So having that sort of thing to anchor you is really key. It's really important.
Yeah. The analogy that I kind of give is that I don't think we should look at our sort of energy levels as like we're a battery that has a certain amount and it just depletes sort of over time. I think we should think of ourselves more like a generator. Like when we do things that give us energy, we are generating the energy. And so that's kind of how it sort of cycles. And I know a lot of people that don't do much in their lives. Maybe they only work and they're always running out of energy. And when I sort of suggest, hey, maybe you should do some of other stuff, the answer is usually like, well, I'm already so tired. I already don't have so much energy with what I'm doing. How can I possibly do this other thing? But it's actually sort of the other way around. I mean, that's something that if you're in high school right now, maybe, you know, just experiment with a little bit as well. Try stacking your plate with a little bit more extracurricular stuff. Do stuff that you really enjoy. Don't put it off because you feel like I have to study more hours. You know, you might be surprised actually. Maybe more stuff means that your efficiency of study goes up and you can study less hours and maybe do even better. Just an idea to throw out there.